Hello friends, I'm Dr. Chetan Nagpure. I'm going to share with you the basics of homeopathy practice. Second part. In first part, I talked about how I evolved in my practice, about importance of thorough case taking. I also talked about importance of understanding the different constitutional types of the patient and how it is important in getting mental state of the patient. Also discussed about finding the possible cause of the disease and thereby treating the cause to cure disease state completely. In second part, I'm going to discuss about how we get the peculiar characteristics of the patient from thorough case taking and how they are important in the selection of the remedy. Firstly, I'm going to talk about importance of getting physical generals in every case. Many times, getting peculiar physical generals helps us in finding the simillimum of the patient. In homeopathy practice, it is very important to get and note down every minute detail about the complaints of the patient. Each unique and peculiar character of the symptoms helps us to find the exact simillimum of the drug and cure the case completely. To begin with, cheap complaint. We have to note down it completely with the exact expression used by the patient. From my experience, reading repertory for several times helped me a lot in inquiring and noting the exact detail of the complaint. Reading various rubrics and sub-rubrics in various sections of the repertory helps us to understand the importance of every minute detail of the complaint mentioned by the patient. Cheap complaint should be complete in terms of location, sensation, modalities, and concomitants. Everything has its own importance. For getting exact location of the complaint, examining the patient exact site of complaint is important. For example, if patient is complaining of pain in his toe, then exactly at what part of his toe is experiencing pain, that you have to examine. Is it ball of toe, joint of toe, extensor tendon, or he is experiencing pain in the fingers? Similarly, if the patient is complaining of back pain, you should look for the exact location of the back. Is it cervical region between scapula, or is it lumbosacral region? Is it sacral region, sacroiliac junction, coccyx, or is it at spine? Getting exact location of the pain most of the time helps us in finding the simillimum. For each homeopathic drug has its peculiar site of action. Nextly, sensation. Kind of pain felt by the patient is also important in finding the drug. For example, I had a patient, she is complaining of back pain. Based on location, I prescribe her chilidonium initially, but it doesn't help her. Then I nextly prescribed her based on modalities, but it doesn't help her. Then her pain started getting worse day by day. Then, after trying allopathy, she again returned back to me. This time, I took details of her pain in exact manner. She told me that she is having burning pain between her scapula, which is a very peculiar of lycopodium. I prescribed her lycopodium, which helped her to relieve her pain completely. Nextly comes the modalities. Modalities of the complaints, that is duration of time. At what time of the day complaints get worse? At what time they get better? Position. At what time patient complaints get worse? And similarly, at the what time patient relieves the complaints. Environmental condition. At what environmental condition patient complaints get worse, and what makes him to feel comfortable. Is it cold weather, hot weather, etc. I will explain it with different example. In cough case, modalities of cough is very important. At what time of the day cough is aggravated? Mostly you see cough case, cough is usually aggravated at night, usually aggravated at lying down position. But in some cases I saw cough is aggravated at daytime. In some cases, I saw cough is aggravated sitting and better by lying down. I have treated a case of mucormycosis with medoranum. In his case, the modalities of cough are very marked. I see he has to lie on his abdomen to relieve cough. Every time patient start coughing, he has to lie on his abdomen to get relief, which is a peculiar of Medona. Lastly, in completing cheap complaint, it is comes concomitant. If you able to get the concomitant in a case, that helps in getting simulum of the case. Every time you have to look for getting concomitant in every case if possible. I share with you example of the case of cough in old age woman. She is coughing constantly, getting breathless. Her saturation drops up to 75%. I tried antimtard in the beginning as she is having ronchi in her chest and she looks very drowsy with the cough, but it doesn't help her. Then on next day I saw she is having difficulty in swallowing food, and most peculiar of all is weeping that I noticed from the first day. She is constantly crying since she is having cough. It is one of the most peculiar concomitant in the case. On that basis, I gave her medicine Kalicar, which relieved her cough and also relieved her all respiratory ailments. Kalicar is the only drug come under the rubric weeping tendency incessantly Katarlop chest in. Now moving to the physical generals. Physical general consists of thirst, appetite, desire, aversions, stool, urine, perspiration, menses, and thermals. I will explain you the importance of each with example. Thirst. Inquiring about the thirst and getting peculiars of thirst in patient always compulsory in homeopathic case taking. Thirst is extremely important in treating acute diseases. We can differentiate drugs in two categories while treating acute cases as thirsty drugs like aconite, arsenic, bryonia, phosphorus, and some absolutely thirstless drugs. Examples are Epismale, Pulsidilla, Antimtart, Nux moscata, etc. Appetite. While treating many cases, inquiring about appetite of the patient is important. Appetite can be very peculiar and very important in finding the exact remedy in individual case. In some, patients have ravenous appetite. In some, they have absolutely loss of appetite. I have treated case of chronic pancreatitis in young boy with lachesis. He was extroverted, loquacious, and most peculiar of his appetite was he can't wait for a food after feeling hungry, which is a very peculiar of lachesis. This kind of appetite you can find in iodum also. In iodum, patient is thin, emaciated, even though they eat well. Desires and aversions. I have seen a peculiar cravings of the patients for particular food types, which are guiding in finding the simillimum of the remedy. Like you see excessive craving for pickle is a characteristics of sulfur. Nitram have excessive desire for salt. They always find need of taking extra salt on food they get served. Craving for chalk, lime, soil is a very peculiar of nitric acid and calcareous. Then comes stool. Inquiring about the bowel habit of the patient is always important. No matter what complaint patient came to see you. It is important in inquiring the patient, those who come to you for bowel complaints like constipation. In stool complaints, inquiring about how many times patient does having urging for stool, at exactly what peculiar time of the patient is having urging. Does he having frequent urging for stool like you get in sulfur noxomica, or does he has complete absence of urging like in alumina? In some cases, urging is so urgent that they can't even wait for a second and has to rush immediately after having urging for stool. In some cases, we find there is insecurity in rectum, loss of control in sphincter, like in cases where we need a drug like aloe socotrina. Nextly, it is important to inquire about the character of the stool. Is it hard, soft? Is it watery? Then odor of the stool. like offensive, and the color of the stool. I give you an example of patient in whom how his bowel habit found to be important in guiding symptom for the selection of exact remedy. His main complaint was back pain. He was very much frustrated with his lower back pain. He visited several big orthopedic surgeons, did all investigations like X-ray, CT scan, MRIs, but no use. He is owner of big electronic shop. He has to sit for a long time at one place, which he find very difficult. Someone from his family took him to me. I took his case. He was peculiar Naxomica constitution from kind of anger, irritability, fastidiousness he is having. In stool complaint, he is having frequent and most of the time ineffectual urging for stool throughout the day. He has to go for several times for stool as he was having frequent urging. Sometimes it is ineffectual and has to stand for stool. That is a peculiar of Naxomica, which helps me to prescribe him Naxomica confidently for his back pain, which relieve all his complaint completely and permanently. Urine. In urine complaint, it is important to ask the patient about the character of urine, color of urine, order of urine, about urging, how frequently patient have urging for urine, does he has any kind of pain while passing urine like burning, when does it occurs, is it at the start of urine or is it while passing the urine or is it after urine. In some cases urine splits in stream. In some cases patient has to wait for to start the urine. In some cases patient can't control urine after urging. In some patient you get to see they have urging more at night than during day. In some peculiar types like cantheris patient has burning in urine 1 or 2 day before their menses. Homeopathy medicines work excellently in treating patients those who are having recurrent tendency of urinary tract infection, cases of renal calculi, cases of benign hypertrophy of prostate, menses. In female patient, inquiring about her menstruation is always important. Most of the females complain their most of the female complaints are either due to menstruation or they are associated with menstruation. Inquiring about menses should be from the start. When the menses appeared, at what age patient started menstruating, inquiring about the duration of menses, such as how many days they last, how many days of interval they start at, are they regular or irregular, do they appear too early or too late, any complaint during menstruation like pain in abdomen, backache, nausea, vomiting. Inquiry should be also made regarding consistency of menses, like are they thick, bloody, black, clotted, smelly, etc. A very weak, emaciated young girl came to me for lower back abdominal pain. She is having recurrent tendency of urinary tract infection. In her case, menses are very painful, usually profuse, and they are offensive and stain very difficult to wash. She had constant thick leukorrhea, which caused constant irritation, edge, and itching at the side of vagina. All these complaints are peculiar of Medoranum. From his family history also, I got her father had tendency to have eruption at prepuce, which confirmed me the medicine, and very few doses of Medoranum cured her completely and also improved her health remarkably. Perspiration. Different constitutions have different type of perspirations. Some like calcareous, nitrums, they perspire profusely. Some drugs have scanty perspiration. In calcarea children, you will get to see they perspire profusely in their head. They moist pillow at night. In treating acute also, inquiring about perspiration is important. Lastly, in physical general comes thermals. Inquiring about the thermals in every case is absolutely important. It is essentially in acute cases as well as in chronic cases. thermals of the patient, that is his relation with heat and cold, as if he is feeling better in cold weather or he is getting worse in cold. Similarly, if he does desire hot weather or his complaint get worse in hot weather is important. I have treated a case of psoriasis in 39 years of old patient. He was having eruptions of psoriasis almost all over his body since 12 years. He frustrated with his eruptions. They are very dirty. The peculiar modalities in his case was his complaints are always aggravated in winter and they are better in hot weather. He needs covering in hot weather, and from that, very few doses of Rustox help him completely. In Rustox, you see eruptions are always aggravated in winter, like in Sorenum. They are chilly patients. The next part of case taking is inquiring about the family history of the patient. Most of the time, family history of the patient gives you important clue to get the right remedy. I have treated psoriasis in a girl of 4 years old completely by very few doses of thyroidinum. In her case, nothing was peculiar. In family history, her mother told me that she is having hypothyroidism and she was badly affected with hypothyroidism during her pregnancy. That on that basis I prescribed her thyroidinum, which helped her completely. I have treated many cases of recurrent urinary tract infection, cases of menstrual disorder with medoranum, where the family history father has history of eruptions at genitals. Now, the most important part comes the mind symptom. That I will explain you in third part of this series by explaining various constitutional types of the patient. Thank you.